Hello, everyone, and thank you so much for joining us. Welcome to one of our monthly Medicare webinars here. My name is Sam, and I will be moderating this webinar for you today. In just a second, we're going to be joined by Michael Corgett, one of our financial advisors, and Michael is going to be giving you a rundown of everything you need to know concerning Medicare for 2025. If you have any questions while he's speaking, I encourage you to ask away. There is a Q&A box, and it is completely anonymous. I apologize, we will not have time to answer them directly with you live today on the webinar, but I will make sure one of our financial advisors can reach out to you either through phone or email after the presentation and get your questions answered. Throughout Michael's presentation, I will be entering some links. They're going to pop up on your screen. They're going to guide you to various resources we have available, one of which will be our calendar where you can book an appointment with one of our financial advisors. Another link may be a link to our YouTube channel or our LinkedIn where you can follow us. Please consider following us on either one or both of those platforms. We post tons of retirement and healthcare related content weekly, and we really think you'd get some value out of it if you considered giving us a follow. And if you do, thank you in advance. And as a quick reminder, we are not affiliated nor endorsed whatsoever by any specific company. We are a completely independent group of financial advisors here. So please keep that in mind as you're listening along today. And with all of that out of the way now, we're going to get started with Michael Corgett.
Thank you, Sam, and thank you everyone for joining us today. I know I really appreciate it. Today's webinar is about Medicare. This is basically the government's insurance program for the elderly. You essentially it becomes available to most of us when we turn 65. So we're going to talk a bit about Medicare and some of the updates on Medicare. We'll compare Medicare to Medicaid, and we'll also talk about Medicare supplemental and Medicare Advantage insurance plans, which can supplement and or replace Medicare coverage. Medicare is the government's insurance program. It's health insurance for people at the age of 65 or older, or certain people under the age of 65 if they are currently collecting Social Security disability benefits, and or an individual that has end-stage renal disease. Enrollment for Medicare usually starts 3 months prior to your 65th birthday. Enrollment is done automatically for people who are currently getting Social Security. So if you started your Social Security at 62, 3, or 4, you will be enrolled automatically. And or if you've been getting disability benefits for 24 months. Now Medicare, it doesn't change other than some of the out-of-pocket costs are concerned, but there are things that you're going to want to know about when it comes to supplemental and or Advantage plans, which I'll talk about here in a few minutes. What does Medicare guarantee? Well, it guarantees access to medical care here in the United States. Essentially, if a doctor and or a hospital accepts Medicare, you are guaranteed that that doctor and or hospital, whatever the costs are, will be covered by Medicare. And Part A for hospitalization has certain co-payments. Part B has certain co-insurance, and that's medical insurance, which is primarily doctor's visits and so on. It is a standardized benefit program. Everybody gets the same program. There's not different plans for different ages or different people in different states. It is a standardized program. It does protect you against catastrophic expenses. That's one of the main ideas behind Medicare. And there is no denial for pre-existing conditions with Medicare. Once you turn 65, if you have any health issues, they will be covered by Medicare, subject to some potential out-of-pockets expenses, which Medicare does have those as well. So these are the pluses. What does Medicare not cover? Well, it doesn't offer full coverage. There is a co-insurance level for Part B benefits. Medicare will pay 80%, and you will have to pay 20%, and there is no cap on that 20%. So your out-of-pocket could add up. It could add up to a significant amount of money depending on how much you use Medicare. Medicare does not cover long-term care expenses, nursing home expenses. It does cover rehabilitation benefits in a nursing home for a certain number of days, but long-term care is not covered. There's no limit on out-of-pocket costs as well. There is a cap, thankfully, on the Part D, which is the prescription drug program, where you have a deductible, and then you've got coverage, and then you've got what's called the donut hole, and then there's a cap. So you do have a light at the end of the tunnel as far as your Part D expenses might be, and it doesn't cover non-essential services like cosmetic surgery, going to the dentist's office, hearing aids, these sorts of things. It is primarily the government's medical insurance program. I talked a little bit about Part A is the hospitalization insurance, covers hospital stays, skilled nursing. Again, this is after a hospital stay, hospice, home health care, and most people pay no premium for Part A coverage. Part B is the medical insurance portion. This covers all your doctor's visits and outpatient care, preventive services, the things that you should be getting done on a regular basis to make sure you remain healthy. And there is a monthly premium for that. That monthly premium is currently $185. It can be deducted from your Social Security check, and it is a monthly premium. So that's essentially all the government is going to charge you for this catastrophic medical coverage that's available, called Medicare. Medicare Part A, this is the hospitalization. There is an inpatient deductible, which has gone up year after year. There is a hospital per day copayment from the 61st day through the 90th day. After the 90th day, you pay 100% of the cost, which is essentially the $838 a day. And there is a skilled nursing facility coinsurance charge per day as well. Those are, the first 20 days are covered by Medicare, just like the first 60 days are covered for the hospitalization without any copayments. After the 21st day and beyond, there is a per day cost to that skilled nursing facility. So again, there are some expenses potentially if you are hospitalized or do wind up in a skilled nursing facility. And those costs do go up year after year. Not too significantly, pretty much at the rate of inflation, 2.7% for 2025. There have been higher increases, there have been lower increases in the past. And down here at the bottom of this slide, if you paid into Medicare less than 30 quarters, to be eligible for Social Security, you have to have paid Social Security taxes for 40 quarters or 10 years. You can be eligible for Medicare for 30 quarters. If you have less, you pay a larger monthly premium for Medicare than if you've got at least 30 quarters, as you could see here. So you've got to keep that in mind. For the most part, all of us are covered by Medicare and fully covered by Medicare. But there are those folks who do well financially, and there is a potential to where that Part B insurance premium, which I mentioned is $185 a month, could be more. If you're a married couple and you earn more than $212,000 jointly or $106,000 individually, you can be charged an additional premium known as IRMA, the Income-Related Monthly Adjustment Amount. Just remember IRMA. That adjustment is tacked onto the regular monthly premiums for both Part B and Part D insurance premiums. And what you see here in this table is moving forward above the levels that I just talked about. A married couple, if a married couple was earning, let's just say, $350,000 a year, their Part B premium per person, husband and wife, would be $480.90 a month. So there is an expense for being successful and earning a good living. Now there are options, and there is an ability to get waivers of these premiums, especially if you're just starting Medicare and you did well financially prior to going on Medicare. There's no guarantees, but there are options, and you will want to talk to the Medicare folks about those options. Here's an example of someone who's on Medicare and has a spouse who's not eligible for Medicare yet, but their income is under the $212,000 threshold. Bob, his total insurance premium is going to be Part B, the 185. He's got no cost for Part A, but Bob has chosen to also get a Medicare supplemental insurance plan and a Part D insurance, which is prescription drugs, insurance plan. So he's spending a total out of pocket of $312 a month. The supplemental insurance plan is insurance that layers on top of Medicare. It is a separate insurance policy issued by a company like Cigna or United Healthcare or Blue Cross and Blue Shield. And these policies will typically cover many of those out-of-pockets and those deductibles and that co-insurance that Medicare does not cover. There are different levels of supplemental coverage, and there's obviously different premiums. The more coverage you ask for, the higher the premium. His wife Jane, on the other hand, the only option that she has is to go through the the healthcare exchange, or what's joyfully called Obamacare many times. And she gets a mid-level PPO program, a silver plan with Blue Cross and Blue Shield, and that premium is $1,200 a month. It is very expensive to buy health insurance on your own if you're getting it outside of an employer-paid plan. But in this case, Bob's family is going to spend a little more than $1,500 a month in premiums before he or she gets any coverages moving forward. And let's talk about Medicare supplemental plans versus what's called Part C or Medicare Advantage plans. Medicare supplemental plans or Medigap plans are supplemental insurance policies. So you have your Medicare and then you have your supplemental insurance policy in addition to Medicare. You keep Medicare, you still choose your own doctors and hospitals. You have some premiums for this insurance, but it does eliminate a lot of these out-of-pocket expenses that I mentioned earlier. Those premiums could average anywhere from as low as $90 a month to $200 and possibly more a month. It would cover all routine services. You would get coverage anywhere in the United States, which Medicare is accepted all over the country. And that insurance is guaranteed to be renewable and benefits will never change. That is a key that I want to make sure I point out. If you do get a Medicare supplemental insurance plan, you are guaranteed the coverage. You have no pre-existing conditions. There is nothing that can be limited by your Medigap insurance carrier if that's what you get to start with. Now, the other option is Part C or Medicare Advantage. This is a Medicare replacement program. It is also with an insurance company. They typically don't have any monthly premium or very small monthly premiums. They typically they cover all of those out-of-pocket expenses, those per day expenses that I mentioned earlier as well. One of the biggest issues is you have to use their doctors and hospitals. So they have their own networks of doctors and hospitals, and you need to stay within that network. If you choose to go to a doctor or a hospital outside the network, you're going to pay 100% of the bill. So Medicare Advantage insurance companies are many of the same that I've mentioned. I mentioned Cigna, United Healthcare, and Anthem Blue Cross and Blue Shield. Many of them offer both. Medicare Advantage is less out of pocket and typically very good coverage long term at no premium out of pocket, but you've got to live within their framework, especially their doctors and hospitals. The one thing that you've got to be aware of when it comes to Advantage plans is if you choose to go to an Advantage plan and you become disenchanted with your Advantage carrier and Advantage plans in general, and you want to go back to a Medigap insurance policy, you will have to prove insurability. And if you do have to prove insurability, you could be denied for certain health issues that you have by that insurance company. That is guaranteed in the beginning, but leaving and coming back can be a problem. So please keep that in mind. Medicare Advantage plans do take the world by storm, that you see the commercials for them all the time, especially in the last couple of months of the year. But many of these insurance companies are beginning to see the facts that they are spending too much money they're providing too many benefits, and they're going to have to either cut back on those benefits or start to charge more premiums. So please keep that in mind. Where you live can matter as far as how much your health insurance costs you. The darkest blue states are the highest individual insurance premiums, and some of the lighter blue states are the lower insurance premiums. So, New York, very expensive to buy health insurance, whereas in Colorado, not so much. You could see it might cost $955 a month in West Virginia, but the state right next door in Maryland, it only costs half that. So again, what states you live in and the carriers and the doctors and the networks that are in those states, it does matter. It's typically cheaper in the Midwest than it is on either coast, but that again, that is no guarantee. And the premiums vary in 2025. Again, these are premiums that are based on a 40-year-old buying a silver plan on the healthcare exchange in various states. The average cost is $627 a month in 2025, a 7% increase in premium from 2024. And the 5 steepest states in costs are, as you can see here, Vermont, New York, Alaska, North Dakota, and Utah, with, in some cases, very significant insurance premium increases. Now, let's jump from Medicare to Medicaid. Medicaid is both a federal and state insurance plan. It helps to pay health insurance costs and many other expenses for folks who just have a limited income. Okay? Some people do qualify for both Medicare and Medicaid, and Medicaid does cover some services that Medicare does not cover or only covers partially. So a comparison between the two. Medicare, again, is the national insurance program for the elderly as well as the disabled. Medicaid are statewide programs, and they do vary state by state as to what's covered and not covered. Is it administered by a state government, but they do have to follow certain federal rules. Again, it is health insurance for people that have a need, primarily a financial and potentially a non-financial need. Whereas Medicare covers the elderly, again, people over 65, those that are on Social Security disability or have end-stage renal failure. It is the nation's primary payer for health coverage, whereas it's the states for Medicaid. So there is a big difference between Medicaid is primarily for the poor, but it also does cover mental health benefits and some long-term care services for those people who do not have the money to pay for those services. So I've said an awful lot about Medicare and a little bit about Medicaid and the various Medigap and Medicare Advantage plans. So there's an awful lot to talk about. Why would you want to consider to talk with a firm like ours here at the Retirement Group? Well, we're a team of advisors with an awful lot of experience. We have offices nationwide. We work with a lot of Fortune 500 companies specifically, so we've got a very solid knowledge of all of your benefit programs, including your pension and your 401k. And finally, we're happy to offer a complimentary cash flow analysis or a retirement plan. All you have to do is ask us for it. So take the opportunity to give our office a call or to send our office an email, and whatever questions you might have, go right ahead and ask them. If you scan the QR code here on the left, you could schedule a meeting with one of us, including myself. If you scan the code here on your right, you can follow us on LinkedIn, and we maintain a very robust LinkedIn page with a lot of resources tied to it, including our future webinar schedules. So give us a call, send us an email, schedule a meeting. We look forward to hearing from you. And, as I said, I've talked an awful lot about Medicare, Medicaid, and then the various insurance programs. It's an individual choice. It's an individual decision. Everything's different for every person and every couple out there. So just please keep in mind, reach out to a professional. We'd look forward to the opportunity to speak with you and talk about this and your retirement and anything else that's important to you. I really appreciate you joining us today. Thank you, and have a great day.